Good morning. This is Dr. Timothy Scott Beck here at LifePoint Medical to give you my Monday morning update on March the 25th of 2024. I want to thank you for listening, and I want to share some news with you today that's hopefully going to help you with your own life and help you with us and get us working on the same page. First of all, the thing that I want to really talk to everybody about is scams. And the reason I'm talking about these scams is because they're affecting my life and the people around me. And I've actually been a victim of these scams before, so has my wife, because they've got so elaborate. And they have really done a good job of making these scams so that they are extremely realistic, and they are playing on everybody's vulnerabilities if you are vulnerable in any way, shape, or form. And they can be via telephone or and I've been scammed via the telephone, I've been scammed via Facebook, I've been scammed in my own email. Okay, so, and it's really, at this point, it's hard to tell what's a scam and what's not, to be honest with you. So please be mindful of the scams going around. And you can imagine how hard it is for me, because we have outreach programs and outreach things that Medicare and the insurance companies want us to do, and calling patients. And we're in the calling with all these scammers calling you, so that nobody knows what's right or what's wrong, okay? And even they use the identities from my phone to talk to people. I know that happens. They do it called call mirroring, just like they did that with the Raven County Sheriff's Department to me one time when they gave me the number and it answered Raven County Sheriff's Department, but it was not the Raven County Sheriff's Department. So we know all this is going on. So I just want to make you aware of it. If you're young, you need to look after your parents, okay? And if you're older and you're getting phone calls and you're giving people information, you need to talk to your children about it or talk to somebody about it, because it's probably not legitimate, okay? And so please just be mindful of it, okay? If you got a family member that thinks they've won the Publishers Clearinghouse sweepstakes, they haven't won. It's a scam. And I've looked up a lot of stuff on the internet where they're talking about this is just a huge issue. And I just want to alert you about it. Protect your family members. Look after them like you would yourself, okay, on this deal, because we got to help people who are getting scammed. The next thing is I am seeing quite a bit of cancer, more cancer popping up here in the last couple of months than I've really seen in a while. I don't know where it's coming from, okay? I do think some of it has to do with COVID and the fact that the medical system got all out of shape during COVID, okay? But it also comes back to the annual wellness visits, because that's really our only tool we have to combat people, to combat them looking for your cancers, or the ones that we can look for. So the three that are most prevalent here that I think we all need to pay attention to, and I've seen a cancer from each one of these places, was, first of all, we do mammograms, and we bring those up during the wellnesses, okay, because we want to detect breast cancer, and we're really interested in getting to breast cancer before it metastasizes and hurts people, and that's why we do mammograms, okay. The next one is the colonoscopies. We recognize that colonoscopies do help us detect early colon cancer, okay, and we recommend that you get those done based on the things, and that's one thing that we discuss with you during the annual wellness visit. And then the third one is low-dose CT scan of the lungs looking for lung cancer. So I've seen all three of those cancers pop up: breast, lung, and colon. And the question is, did that person get the appropriate surveillance that they needed to prevent those cancers? And that's exactly the main three that we talk about during our wellness. Now, there's others that's not all of them, but that's the main three that I see popping out, and the main three that we address at the wellness visits, okay? So, I would ask that if you haven't made a wellness visit with us, that you go ahead and call us today and get that wellness set up. Number two If you've got a wellness schedule, please honor that visit. Please show up, and please participate in it in such a way that we can get the safety stuff in place that we need to protect you and your life. Okay. Try to make those appointments. A lot of people don't think they're important, but it's overwhelming sometimes. When it just scares me to death when we see a patient, when we get a test and we save their life, and we wasn't sure they were going to get that test or not, and they did, and it did what it was supposed to do, I guess is what I'm trying to say. Trying to take some of the guesswork out of it and just get people taken care of the most appropriate way is what we're trying to do. So help us with that. If you don't have an annual wellnesses, get one. Call us. We want to get you in. We want to get you seen. We want to cover your bases related to your age and your risk factors. And number two, if you have an annual wellness visit, keep the appointment. This could be a life or death situation. We're just trying to help, and we're trying to do what we're supposed to do. So thank you for participating if you are. And then the last thing is we do get occasional people who are mad at us or angry with us because they had to wait here in the office. Sometimes it's legit, and I understand why they're upset. Sometimes it boggles my mind. I'm like, not sure what they were expecting. Okay, but here's the deal. Number one, you will not find somebody who has thought more about getting you back into the room and seen and taken care of in an efficient, respectable manner that makes you feel good, makes us feel good about what we're doing, and we cover all the bases we need to, okay? And the problem is when a patient comes in, we don't know whether that patient's going to take a minute or two or an hour or two, okay? You just can't tell, okay? And we've got to be prepared to handle any type of scenario that comes through the door. So therefore, I have to do my scheduling, and I work on the schedule. I'm the one that produces the schedule and tells the ladies what to do. And I've come up with the best scheduling scheme that I can. And what we do is we schedule everybody on the hour. We get a bunch of people in, and we get them in and out within an hour time frame. So nobody has to wait more than an hour. But the reason I do this is because it automatically compensates for people who show up early. It automatically compensates for people who show up late. And it accommodates the people who show up on time. So it's the best way I know how to do it to get to you, to get what your things answered, and to get you, out of here in a reasonable amount of time with getting what you need. A lot of people don't understand it. We work on it on a daily basis, and I just want to give you that word. Hey, we're thinking about it. We're working. If you are waiting, we're trying to figure out how to manage that. We're listening to people. We're listening to your feedback. We're recognizing that, 90% of the time everything goes great. It's that 10% of the time where we've got to do better and help you so that you don't feel like we're not seeing you or working in an efficient manner. Okay, I don't think you'll come in here and see us all standing around not doing anything and not taking care of anybody, okay? That's not what's going to happen. I promise you that. It's just sometimes we get overwhelmed, and we got to do what we got to do to get every patient taken care of in a respectful manner, in a safe manner. So that's our dilemma. We face this challenge head on, okay? We don't run from it, and we do the best we can, okay? And I appreciate your cooperation with that. With all that being said, thank you so much for listening to me. Have a wonderful day. Call us at 706-782-0016 if you need us for anything. Thank you so much for listening. Goodbye.